The prescription pile problem. Many older adults today face what doctors call the prescription pile problem. Polypharmacy, taking 5 or more medications at a time, has become common among seniors. For many, daily life is organized around pill boxes divided by the hour, with drugs for blood pressure, cholesterol, sleep, digestion, blood sugar, and pain all lined up. It looks like careful management on the surface, but the reality is that these stacks of pills often create as many difficulties as they try to prevent. The problem isn't just the quantity. It's how one drug leads to another. A blood pressure medication can cause dizziness. That dizziness increases fall risk, which may require pain medication after an injury. Pain medication, in turn, can cause constipation, sparking the addition of a laxative. A treatment designed to help the heart ends up reshaping life in ways that no one planned. This isn't an unusual story. It's the pattern at the center of polypharmacy. Research shows that polypharmacy doesn't just create inconvenience, it heightens risk. Older adults are more vulnerable to drug interactions because their liver and kidney function often decline with age. Medications that would be tolerable for a 40-year-old can accumulate in the system of someone in their 70s, intensifying side effects and making standard doses too strong. The result is sometimes extreme fatigue, confusion, or even dangerous medical events. In fact, polypharmacy increases the likelihood of adverse drug reactions and hospitalizations, with many seniors ending up in emergency rooms not because of their original condition, but because of medication conflicts. On a day-to-day level, this takes a heavy toll. Instead of feeling energized, many older adults live in a fog of side effects. Fatigue, digestive discomfort, weight changes, and mental cloudiness become accepted as normal aging when they might actually be consequences of drug combinations. And because specialists often prescribe medications without full visibility into the others a patient uses, even well-meaning decisions can create complicated overlaps. What looks like healthcare progress can quietly become a cycle of managing medication side effects rather than treating disease itself. For a lot of seniors, the pill organizer symbolizes this burden. The brightly colored compartments, meant to bring order, serve as a reminder of just how many moving parts there are to get through a single day. And, unlike misplacing a set of keys or a grandchild's phone, missing or doubling up on a pill can have a serious impact. Mistakes happen often, especially when prescriptions multiply faster than anyone can fully keep track. This is why the prescription pile weighs so heavily, not just physically but mentally. Living with multiple medications can make someone feel less like a person and more like a patient defined by conditions to be managed. Each new prescription signals another layer of dependency. And while some drugs are essential and life-saving, it's clear the system often defaults to adding rather than asking whether there might be a way to subtract. That's where fasting offers a different pathway. Instead of addressing symptoms with yet another pill, fasting works on the deeper processes that made those symptoms emerge. Blood pressure, for example, has been shown in supervised fasting programs to decrease significantly, reducing or eliminating the need for medication. Blood sugar regulation often improves, meaning some patients with type 2 diabetes require less support from drugs. And when inflammation lowers, pain tends to ease, which can lower reliance on painkillers and all the secondary medications they necessitate. The difference is this: rather than patching problems one at a time, fasting shifts the entire baseline of health. It is not an overnight cure, and it is not safe for everyone without oversight, but the documented results show that for many older adults, medication lists do shrink. The domino effect begins to reverse. Fewer prescriptions leading to fewer side effects, leading to fewer follow-up medications. It's important to recognize balance here. No responsible physician would suggest that every drug can or should be thrown away. Some conditions absolutely require long-term pharmaceutical support. but by easing the metabolic dysfunction that drives so many prescriptions, fasting creates opportunities to reduce dependency. A senior moving from 8 or 9 daily pills down to 3 or 4 isn't just experiencing a smaller regimen, it's regaining a sense of freedom. This freedom extends beyond the body. There's a psychological lift in no longer feeling tethered to medication schedules that divide the day into strict intervals. That shift restores dignity and builds confidence. People see themselves less as patients and more as full participants in daily life. They move through days with more energy, fewer restrictions, and without the looming worry of managing side effects from a complex mix of prescriptions. The benefits ripple outward to families and the healthcare system as well. Fewer prescriptions often mean fewer emergency room visits, fewer hospital stays due to drug interactions, and decreased financial strain from extensive pharmacy bills. Families worry less about whether mom or dad is keeping the schedule exactly right, and seniors themselves can focus less on medical logistics and more on meaningful activities. Taken together, this picture is clear. The prescription pile is not an inevitable part of aging. It reflects a default to management by addition, layering drug upon drug in the hope of control. Fasting approaches it differently by addressing the metabolic roots of disease and restoring stability without adding to the chemical load. Later in this video, we'll go into exactly how seniors can approach fasting in a way that reduces medication needs safely, along with the precautions required to prevent risky interactions. For now, the key point is this: the cycle of adding prescription after prescription isn't the only option, and there is a way forward that doesn't depend on constant pharmaceutical expansion. And that brings us directly to the next misconception many seniors have lived with for a lifetime: the idea that you must never skip a meal or you'll get weak. Fasting versus eating regularly myth. For decades, nutrition advice emphasized steady eating patterns, but one of the most persistent messages was the belief that eating regularly prevents weakness. Older adults in particular were cautioned that skipping meals might leave them vulnerable to sudden drops in energy or blood sugar. The assumption was that frequent eating was the safest way to stay fueled, but research now paints a more nuanced picture. For many people, short fasting windows do not cause weakness. Metabolism is equipped to shift from glucose to stored fat and ketones, which can provide steady energy. At the same time, it's important to acknowledge that those on medications affecting blood sugar or blood pressure need medical supervision before making changes to eating patterns. Understanding how this works begins with energy storage. Normally, the body uses glucose from food as its main fuel. When meals are spaced out, the body transitions, first drawing on glycogen in the liver and muscles, then shifting toward producing ketones from fat stores. This change usually occurs somewhere in the 12 to 24-hour range, though the timing varies. Ketones are a reliable alternate energy source and are frequently described as supporting clearer thinking and more stable physical energy. In this way, fasting often feels less like deprivation and more like switching power modes. Why does this matter so much for seniors? As the body ages, processing sugar and starches often becomes less efficient. Frequent eating can extend blood sugar spikes throughout the day, pushing the pancreas to release insulin repeatedly. Over time, this can create or worsen insulin resistance, which leaves people feeling sluggish after meals and more fatigued overall. Brief fasting intervals interrupt this pattern. By reducing the number of daily spikes, insulin levels can stabilize, and cells may gradually respond to insulin more effectively again. Many older adults describe experiencing steadier energy once they establish a consistent fasting routine. One easy comparison is the hybrid car. When one fuel source runs low, the system transitions seamlessly to another. Human metabolism works the same way. When glycogen stores decline, fat takes on the role. This isn't evidence of starvation. It's normal physiology that developed long before the modern culture of constant snacking. The problem is that decades of eating every few hours have kept many seniors locked into one mode, leaving their bodies out of practice at switching fuels. Fasting reintroduces that capacity, allowing people to discover that they can go longer without food than they may have thought possible, often with less fatigue, not more. Critics sometimes argue that fasting places older adults at risk of losing muscle. Here again, the details matter. Short fasts and intermittent fasting schedules generally preserve lean mass when paired with adequate protein intake and light resistance activity. In fact, the hormonal shifts during fasting often support tissue maintenance. What really protects seniors' strength is consistent protein in meals and simple strength work like resistance bands, walking with light weights, or chair exercises. The point is not that fasting eliminates all concern about muscle, but that with a balanced approach, it can work alongside practices that support lean tissue rather than erode it. For those who try fasting under safe conditions, the reported effects are often the opposite of weakness. Blood sugar steadies between meals, digestion gets a break, and energy doesn't dip as sharply after eating. Some seniors even report fewer issues with bloating or heartburn because long pauses between meals reduce gut strain. That sensation of balance, steady rather than spiking, is the outcome people often find most surprising. Instead of feeling frail between meals, many feel noticeably more resilient. The role of ketones is especially important here. They not only provide fuel, but they do so in a way that often benefits the brain. Unlike the swings of glucose highs and lows, ketones deliver a more consistent energy flow. This is one reason some people describe improved clarity or focus during fasting windows. It isn't a universal effect, but for many, this gradual shift away from sugar-dependent swings is what allows the body to feel stable even without food intake every few hours. So why did the constant eating message last so long? Much of it is cultural habit, reinforced over decades. The food industry's promotion of snacks as essential certainly played its part, and early medical advice sometimes blurred together the experience of diabetics on glucose-lowering drugs with that of otherwise healthy people. What endured was a message that missing a meal was inherently harmful, when in many cases it was only those with very specific medical conditions or medication routines who faced such risks. For healthy adults, the evidence does not support the idea that 3 large meals plus constant snacking is the only path to stable energy. At the same time, seniors considering fasting do need individualized guidance. People with diabetes, especially those taking insulin or medications that lower blood sugar, are at risk of hypoglycemia if their medication isn't adjusted. Likewise, those on blood pressure drugs could experience dizziness if blood pressure drops during fasting. This is why every major medical institution stresses that older adults should discuss fasting with their clinician before beginning. The right structure, length of fasts, frequency, and medication balance can make the difference between experiencing benefits and encountering preventable problems. When applied properly, fasting provides older adults with a way to access their stored energy instead of being dependent on constant refueling. That changes how they experience daily life. Activities that once felt draining can feel manageable. Stretches between meals no longer bring on panic, and reliance on sugary snacks for energy fades. These adjustments don't just improve numbers on a chart, they directly shape quality of life. Seniors often describe walking more freely, thinking more clearly, and feeling lighter in their routines. And this adjustment sets up another important benefit. When energy steadies, people begin to notice how their bodies handle movement and recovery differently. Less strain on the digestive system, fewer big swings of glucose and insulin, and steadier blood flow all contribute to a body that is more comfortable to use day by day. That comfort influences mobility, endurance, and how easily seniors keep up with routines without relying on stimulants or snacks. In that sense, the real myth isn't only about weakness after skipping a meal. It's about underestimating how adaptable the body remains, even as it ages. Fasting is not about depriving the body of what it needs. It's about creating space for systems to reset, stabilize, and draw on reserves meant for exactly these intervals. For seniors willing to approach it safely, this shift can be a turning point in breaking free of the cycle of constant eating and the energy fatigue it brings. The larger question then becomes what happens beyond energy and stability. When fasting interrupts not only calorie intake, but also some of the metabolic strain of constant food processing, it introduces changes in inflammation and recovery. And it is here where the body's aches, stiffness, and slowing movements intersect with how it manages inflammation, that some of the most pressing challenges of aging begin to look different. Mobility, energy, and joint relief. Mobility, energy, and relief from joint discomfort form a large part of how older adults experience daily life. Many seniors describe the feeling of slowing down as if it's an unavoidable part of getting older, but much of that decline is fueled by chronic inflammation rather than age alone. It's not just birthdays that make knees ache or stiff backs resist movement. Years of low-level inflammation accumulate until they begin to interfere with everyday function. Once stiffness settles into joints and tissues, once easy activities such as climbing stairs or bending in the garden begin to feel like burdens, what makes this decline so frustrating is not only the physical discomfort, but also the shrinking of life's activities as people gradually give them up. It's easy to mistake this loss for just aging, but clinical and preclinical studies have reported that fasting lowers certain inflammatory signals in the body, and this reduction has been linked to improvements in joint symptoms for some participants. The changes don't appear for everyone or on the same timeline, but when progress does come, seniors often notice that stiffness fades, walking feels easier, and joints become less demanding. Instead of inflammation pushing against movement, the body begins to feel more cooperative. It's not a miracle, responses vary, but it is a biological shift that can emerge when digestion rests, immune signaling cools, and tissues have more resources for repair. Without an intervention, the sequence usually follows a predictable loop. Pain makes movement unpleasant, so activity declines. Less movement weakens the muscles that support joints, which raises pain levels further. The cycle reinforces itself until everyday mobility becomes a constant struggle. What surprises many seniors is that fasting can interrupt this loop. By lowering the inflammatory drive, pain begins to loosen its grip. With less stiffness, walking resumes, strength builds back up, and the cycle shifts in the opposite direction, from decline back toward recovery. Energy is another piece of this story. Chronic inflammation doesn't just burden joints. It undermines muscle performance and drags down overall stamina. Seniors who take up fasting under supervision often describe a shift in how their body uses fuel. As insulin drops and stored fat contributes more energy, tissues run more efficiently. That steadier supply bypasses the familiar pattern of sugar highs followed by energy crashes. When mobility improves alongside this steadier energy, the result is a body that not only moves with less restriction, but also has more capacity to sustain that movement. A clear example is walking. For someone with inflamed joints, even a short stroll can bring dread because of anticipated pain. But when fasting is practiced consistently, inflammatory messengers such as cytokines are reduced, and pain signals calm. Walking becomes less punishing, which encourages longer distances. More movement strengthens the very muscles and ligaments that help stabilize joints, further easing pressure and expanding capability. The benefit compounds. What begins with reduced pain extends into long-term improvements in mobility. Gardening offers a similar illustration. Many seniors treasure it for both exercise and enjoyment, but abandon it once joint discomfort makes bending and gripping too difficult. By reducing swelling and stiffness, Fasting can give back flexibility in the hands, hips, and knees. For some, that translates into reclaiming afternoons among plants that they once thought were gone for good. These changes don't erase decades, but they restore functions that bring tangible satisfaction. Family life reflects this shift too. Activities with grandchildren often require kneeling, lifting, or playing outside. For seniors confined by pain, these joyful moments can feel off-limits. When energy steadies and inflammation eases, those barriers fall. Stories frequently emerge of grandparents surprising both themselves and their families with how much they can suddenly manage, whether it's pushing a swing set or joining a walk in the park. These regained abilities carry enormous emotional weight, reinforcing not just mobility but also identity. Both intermittent fasting and longer, supervised fasts have shown effect in reducing markers of inflammation. The pace and depth of results vary. Intermittent fasting, where eating is limited to part of the day, often brings gradual joint relief over weeks as inflammation falls steadily. Longer water-only fasting, carried out in clinical settings, has produced more rapid and pronounced results for certain patients. The difference lies in intensity and supervision, but in both approaches the trend runs the same direction, away from an inflamed environment and toward restored ease of movement. Skeptics are right to point out that weight loss also eases joint stress, and it certainly does. Yet studies have shown fasting's benefits extend beyond the scale. Blood tests reveal reductions in inflammatory proteins independent of weight changes. This means a person may not drop many pounds, but still notice their joints loosening. Relief isn't only about less force pressing on knees or hips, it's also about calmer chemical signaling inside the tissue itself. A mental dimension blends into these changes. Living with pain is draining not only on the body but on the mind. The constant effort of coping erodes motivation, which accelerates decline. When fasting reduces discomfort, the reservoir of energy available to mood and focus often rises. Seniors describe feeling brighter, lighter, and more ready to try activities again. What begins as a physiological improvement becomes a psychological reawakening. The desire to rejoin life returns along with the physical means to do so. Of course, fasting is not a guaranteed replacement for medical care. Severe or advanced joint conditions, such as end-stage osteoarthritis, often still require direct treatments, targeted therapies, or even surgical intervention. Fasting can reduce symptoms and support better function, but it isn't a cure-all or an alternative where medical procedures are necessary. This is why ongoing guidance from a healthcare provider is crucial, especially for seniors whose conditions involve more than low-grade inflammation. For those looking to apply fasting safely, pairing it with light daily activity and sufficient protein intake is a practical step. Gentle walks after meals, resistance exercises with bands or light weights, and attention to protein at meal times help preserve muscle during fasting routines. This combination maximizes the gains in mobility while protecting strength, which is key for joints that depend on surrounding muscle to operate fluidly. Done together, fasting and movement form a loop that restores rather than erodes function. What stands out is that fasting doesn't just mask symptoms with short-term fixes. A painkiller can make a stiff joint feel less raw for a few hours, but leaves inflammation intact. Fasting recalibrates the internal environment so that the signals causing pain are reduced at the source. A hand gripping without strain, a knee bending without resistance, or a back able to rise from a chair more easily are not illusions. They are concrete signs that body systems are functioning differently. Mobility regained in this way carries an added weight because it represents freedom. Walking without hesitation, gardening without grimacing, and joining family without worry all shift the daily experience of aging. Seniors frequently note the satisfaction of regaining roles and activities they assumed were gone. Independence, once narrowed by pain, opens back up. Fasting, by calming inflammation and steadying fuel supplies, provides the conditions for these changes to happen naturally. This physical renewal also sets the stage for another area where aging often steals the most cherished qualities, the sharpness of the mind. Many older adults accept physical slowdowns, but fear cognitive decline far more, worrying that memory and focus will slip away in ways movement never could.